So we do a thorough assessment of the back, including the range of motion and the muscle strength examination. We do individual glides at every single level, and then we look at the posture as a whole. This patient right here has good posture, has good kyphosis, good lordosis over here, so he's good that way. The lateral shifts in the spine, I'm going to be better able to judge once he's on the table. So let him get down on the table. We'll need some oil gel for the handheld unit to be able to glide easily. Now I'm going to trace his spine all over to see if there is any lateral deviation anywhere. Okay, so he looks pretty good around the lumbar area. He's got a little bit of a rotation towards right at the level of L1, which gets corrected around the thoracic spine. It's pretty good over the thoracic spine. And here, perhaps at the level of T4, it's a little rotated towards the left. And pretty good in the upper thoracic, in cervical. So I now know the specific levels where I have to pay more attention and be a little more focused when I'm doing the mobilization on him. I'm going to begin the treatment by starting with the spasm mode. What this mode does is it just relaxes the muscles and gets them ready for the mobilization that I'm going to do later. The spasm mode is timed, it just runs for 15 seconds and then it stops on its own. The next level is going to be the reflex mode. That's when all the muscles get stimulated and they get ready to act again, and we're now training the muscles and later the joints to fall in the right position. So say I want to start working on his lumbar spine alone because I'd actually picked up a level where the spinal rotation was noticed. So I'm going to just start with my mobilization at that level first. So as you can see, this device, I'm just making it walk up the spine in the desired segment of the spine. While I'm running this, I am getting a feedback from the resistance that I feel against that, the little pads that you can see. And that makes me decide what level of treatment does his spine require. So for example, in this case, I can go a little harder, a little deeper. And then I'm going to alternate that with the reflex mode again. And then I can proceed to the next level. I'm going to go up to his thoracic spine. And likewise, I can go up to his cervical spine. So the treatment is in my control. I can focus and target the levels that I want to, which I decide after my initial evaluation. After the treatment continues for around 20 to 30 minutes, depending on how much is the patient's requirement. I'm going to be doing an assessment again just to reevaluate and see if he needs any more treatment now or how much later. Then I'm not going to trace his spine from bottom all the way up. So if you can look at this, his spine is in right alignment. It's absolutely straight with no undue rotations anywhere at any level. This is as good as it gets. Thank you.